Hi and welcome to all the educators out there who continue to provide support for occupational therapy students on placements across Australia. My name's Alison Coleman, and on behalf of the SPEF-R project team, I would like to acknowledge the hard work and generosity of educators who offer placements in a wide variety of settings across the country and provide valuable learning opportunities for students with a diverse range of clients. The following vignettes you're about to see contain small snapshots of different scenarios that students may encounter as part of their placements, such as a team meeting or case conference in an acute mental health setting, a supervision session in a paediatric clinic, or a home visit in the community. In each of these scenarios, you'll see students all managing differently. You may wish to watch them more than once to give yourself an idea of how you feel each student is generally performing before you score them using the SPEF-R. In this scenario, you'll see Elaina, our occupational therapy student, who is just past the halfway point of her placement at an acute mental health inpatient facility. Elaina and her supervisor David are participating in a regular multidisciplinary team meeting. Members of the mental health team include Richard, the psychiatrist, Sonia, the new psychologist, and Mark, the team social worker. A case conference is just about to start, where the team will be discussing patient progress and discharge planning.
Did you have a good weekend?
Yeah, lovely weekend, thanks.
Good.
Well, family.
Oh, wonderful. Hey.
Very well.
We're going to that mental health. That's good.
I just need to check.
And so we have that supervision session.
I wasn't actually sure whereabouts that was. But I've got
Look, we're all here, so let's make a start. The next patient is Margot Robinson. She was admitted 2 weeks ago with her second episode of depression involving a psychotic component. She has schizoaffective disorder. How has she been, and when do you think she'll be able to go home?
Well, Elaina has been working most closely with her, so I'll let her present the OT report.
Thank you, David. I have been working closely with Margot in the Living Skills group. I think she's been participating really well. She listens to the concerns of others, and she's very supportive of them when they talk about their challenges. I have noticed that her affect is always appropriate to the situation that they're talking about.
Great. I like the way that you've been leading that group over the past 2 weeks. What else have you noticed about Margot?
She does present well, and she pays attention to her appearance, which has improved considerably. Her rate of speech has returned to normal, and she's able to follow through with conversation without any signs of psychosis. Her mood has lifted from last week as well. She does have to care for a young son when she returns home, so I've planned to do a shopping assessment with her tomorrow morning so we can go over ingredients for something she may like to cook for her family when she gets home.
Actually, she has a session with me tomorrow morning at 10.
Oh, I didn't realise. Perhaps I can do it in the afternoon.
Yeah, that'd be good.
Actually, I'm meeting with her and her husband and son in the afternoon.
How about I meet with them after your session? That way I get to meet with the whole family and we can discuss together what they all might like to eat. Then we can shop and cook the next day.
Great idea. I think that will really help her self-confidence, as she's been a bit worried about how she's going to manage with cooking when she gets home. Also, the family dynamic can be a bit tricky.
David, that does mean we'll have to reschedule our supervision session. Is that going to be okay with you?
Yes, no problem. I think it's an excellent suggestion.
Oh, good. It sounds like she's stabilising well and should be able to go home by the end of the week. We can discuss this further at our meeting on Thursday.
How did you feel Elaina was progressing in her placement? We asked clinical educators and university academics from 5 states across Australia to rate Elaina's performance in this vignette using 5 items from the SPEF-R. You can see from her SPEF-R online placement summary page, all 75 participants agreed that Elaina was a competent student, with the majority considering Elaina to be performing either proficiently or with distinction at the halfway point of her placement. For item 1.1 on Elena's SPEF-R, the majority of participants, 96%, gave her a rating of 4 or above. For item 1.4, the majority of participants, 97%, gave Elaina a rating of 4 or above. For item 1.5, the majority of participants, 97%, gave Elaina a rating of 4 or above. For item 3.1, 100% of participants gave Elaina a rating of 4 or above. And for item 3.2, 100% of participants gave Elaina a rating of 4 or above. So you can see for all 5 items on the SPEF-R, the majority of participants gave Elaina a rating of either 4, proficient, or 5, performing with distinction, at this point in her placement.
Yeah.
Are you thinking about
no,
mental
that's,
health?
oh, that's really hard. Okay, sorry, I'm just going to go try and
Hi.
Good program.
You remember we have a supervision session coming up Thursday?
Okay, looks like we're all here, so let's make a start. The first patient is Margot Robinson. She was admitted 2 weeks ago with her second episode of depression involving a psychotic component. She has schizoaffective disorder. How has she been, and when do you think she might be able to go home?
Well, Elaina has been working most closely with her, so I'll let her present the OT report.
Margot. I have seen Margot in the Living Skills group. She seems to like it. She likes most of the people that go, except for this one woman who raves on way too much.
What can you tell us about her affect and mood?
She seems happier than she was, I guess.
What about her appearance?
Oh, she looks better than she did. I mean, like her clothes are cleaner and, well, she looked like a total mess when she came in, so, you know, it's an improvement.
Actually, remember we talked about an assessment at our last supervision session halfway? We were planning on doing a shopping assessment with her.
Oh, yep. Yep, I could take her shopping tomorrow.
Actually, she has a session with me tomorrow morning at 10.
And I'm meeting with her and her husband and son in the afternoon.
Well, I was going to book a car, but...
Well, why don't we see her after you at the end of your session while the family are all here? And that way we can plan the shopping with all the family and see what they like. And then we could do the shopping and the cooking on the following day.
Great idea. I think that would really help with her self-confidence, as she's been a bit worried about how she'll manage the cooking when she gets home. And the family dynamic can be a bit tricky.
Yeah, that son of hers is such a nightmare.
Actually, we try not to make judgments about family like that here. In fact, one of the nurses was telling me this morning her mood's always improved when the family visits the ward. She's been interacting with other patients as well, a lot more.
Well, good. It sounds like she's stabilising nicely. Well, she should be able to go home by the end of the week. We can discuss this further at our meeting on Thursday.
In vignette number 2, you can see from Eleina's SPEF-R online placement summary page, all 75 participants agreed that she was not yet competent at the halfway point of her placement, with the majority considering Elaina to be performing either marginally or unacceptably at this stage on her placement. For item 1.1 on Eleina's SPEF-R, 89% of participants gave her a rating of 1, unacceptable. For item 1.4, 80% of participants also gave Elaina a rating of 1. For item 1.5, 80% of participants gave Elaina a rating of 1. For item 3.1, 80% of participants gave Elaina a rating of 1. And for item 3.2, 75% of participants gave Elaina a rating of 1. So you can see for all 5 items on the SPEF-R, the majority of participants gave Elaina a rating of either 1, unacceptable, or 2, marginal at this point of her placement.
Yeah, just check my email, check the dates and times and whatnot, see how we get on with that.
So we have that supervision session coming up.
It should be, yeah. I can show you.
Okay, look, we're all here, so let's make a start. The first patient is Margot Robinson. She was admitted 2 weeks ago with her second episode of depression involving a psychotic component. She has schizoaffective disorder. How is she doing, and when do you think she'll be able to go home?
Well, Elaina has been working most closely with her, so I'll let her present the OT report.
Okay. I have been seeing Margot at the Living Skills group. She seems to be enjoying attending, and she's good at listening to the others. She tries to be helpful when they talk about their challenges. And she's dressing better and paying more attention to her appearance. She looks better than she did too. Her speech is better than it was as well.
You were telling me that she is more animated than she was last week?
Yes, yes. Her mood seems to be better than it was. She's more involved in the group. And we've planned to do a shopping assessment with her tomorrow morning, so we can plan a meal that she might like to cook for her family when she gets home.
Actually, she has a session with me tomorrow morning at 10.
Oh, okay. David?
Maybe we can change it to after lunch?
Yes, that'd be good.
Actually, I'm meeting with her and her husband and son in the afternoon.
Okay. Maybe I can meet with them after your session in the afternoon.
That would be great. Then you can plan her shopping while the whole family's here. They can decide what they'd like to cook, and then you can shop and cook on the following day.
Great idea. I think that would really help with her self-confidence, as she's been a bit worried about how she's going to manage cooking when she gets home. And the family dynamic can be a bit tricky.
Good. It sounds like she's stabilising well and can probably go home at the end of the week. We can discuss this further at the meeting on Thursday.
In Vignette 3, most participants agreed that Elaina was an adequate student, with the majority giving her a rating of 3, which considers her to be performing satisfactorily at the halfway point of her placement. For item 1.1 on Elaina's SPEF-R in Vignette 3, the majority of participants, 59%, gave Elaina a rating of 3. For item 1.4 on the SPEF-R, the majority of participants, 48%, gave Elaina a rating of 3. For item 1.5, the majority of participants, 84%, gave Elaina a rating of 3. For item 3.1, the majority of participants, 76%, gave Elaina a rating of 3. And for item 3.2, the majority of participants, 77%, also gave Elaina a rating of 3. So you can see for all 5 items on the SPEF-R, the majority of participants gave Elaina a rating of 3, performing adequately at this point of her placement. Now you have seen how other educators across Australia have rated Elaina in these vignettes. How would you rate her performances using the SPEF-R?
Thank you again for your ongoing contribution to the clinical education of occupational therapy students. I would like to thank Health Workforce Australia for providing the funding for this project, as well as all the actors, the film crew and members of the SPEF-R project team who were all involved in the creation of these vignettes that were filmed on location through the generosity of the Women's College at the University of Queensland.